how I identify the root cause of your elbow pain, and the exercises I prescribe. My name is Dr. Nick, where I specialize in helping folks over 50 get out of pain, regain strength and mobility so they can avoid frailty and get more life out of living. For these exercises, all you're going to need is a soup can or a light dumbbell. And if you have a lacrosse ball, great, but you can still use a soup can. The first exercise is going to be to help stretch and lengthen the muscles on the back and front of your forearm. So the first stretch that I recommend is nice and easy, elbow bent to your side. Bring your thumb of the uninjured hand, this is the injured hand, underneath the wrist of the injured hand, pull down, fingertips to floor, and then just easily begin to work your elbow into extension or straightening. Hold 5 to 10 seconds and then come back in. We're just easing this stretch, easing this elongation into the tissue so as not to overwhelm it, but just to begin to introduce easy lengthening. Again, 5 to 10 seconds, fingertips down to the floor, 5 to 10 seconds. We're going to do this 10 times. After we've done that 10 times, we can work into a stretch and hold. And then notice my elbow crease. I want you keeping your fingers down and just working your elbow crease up to the ceiling. Holding your elbow straight for about 30 seconds total. So 10 times, smooth and steady. We're not going fast. We're also not going into pain. Go right to the doorstep, just right to the barrier of where it begins to be uncomfortable, and then stop, and then ease your way out of it. The next one is you do just the opposite. We're going to flip your palm up, thumb goes behind the wrist, fingertips all the way down to the floor, and we're going to push our elbow straight. We're going to feel a stretch across the flexors of our forearm. We're going to do that 5 seconds, 10 to 15 times, nice and smooth. The next exercise, go ahead and grab that soup can or light dumbbell. We're going to work strengthening the extensors of our elbow. And the reason why this is so important is because often the reason we have this pain is because of inherent weakness through the extensors. And so we want to strengthen them, but we strengthen them without pain. So this should not be painful at all. Your next exercise, you're going to have a seat in a chair with an armrest with your soup can or light weight. We're going to begin to work strengthening the extensors of our forearm. Now, if during this exercise you have any increase to your symptom pain, I want you to stop and wait and work the other exercises first until this becomes less painful. If it's okay to continue, then we want to introduce some load into the tissue. And we have to do this because the reason why you're having so much pain is because the tendon of these muscles, as it blends into bone, is starting to pull away and irritate the bone. That's why we have that deep toothache pain in our elbow. So what you're going to do is grab the dumbbell or soup can, nice and easy, not a firm grip, just a nice, easy, comfortable grasp. Let the wrist begin in flexion where it's bent down this way, and then just slowly begin to raise it into extension, knuckles pointing to the ceiling. Go as high as you can, again, without pain, and then slowly lower back down. We're going to do this 3 sets of 10. After those feel comfortable, we're going to work an eccentric phase, which means that as I pull up knuckles to ceiling, I'm going to slowly lower, counting to 5. And then if it's feeling tired, I can help my wrist come back up into extension. Again, knuckles to ceiling, and then slowly lower, counting to 5. Do this 10 times at the end of your 3 sets of 10. Now it sounds like a lot of load, and it is for now, but keep the weight very light, keep it very easy. We're helping to work reconditioning of that tendon. Your next exercise, you're going to need a lacrosse ball or a soup can. Put the soup can or lacrosse ball on a countertop or a table. You're going to bring your arm, palm up, put your elbow and forearm muscles right on top of the ball or soup can, and you're just going to begin to roll your forearm over top, massaging out all those tight, tense, irritable muscles on the back side of your forearm. I like to dose this by minutes, so working this 1 to 5 minutes at a time, taking breaks as needed. This should not be painful or irritating to those muscles. We're just finding a way to work out some of the tension often associated with the backside of the forearm. I sometimes like to roll away and then curl my wrist up just to get a little stretch as I work those across all along the backside of my forearm. Again, 1 to 5 minutes. Those are my 4 exercises that I prescribe for all my lateral epicondylitis or tennis elbow patients. If you still have intense pain or a lot of pain, particularly in the morning, it's often because as you sleep, your wrist is bent most of the night. Whether you're a side sleeper and you get your wrist bent up underneath you, under those cases, I like to recommend you use a wrist splint, just something to get you into a more neutral position throughout the night so that as you wake up, it's not excruciating pain and tightness. I also like to use those exercises in the morning as a way to warm up the tissue. Just easy. Begin to warm up those tissues, get it to be ready to lengthen so that as we go about our day, it's not as shocking a movement or a motion to use our hand and get more irritating pain. Consider the fact that every time we get spikes in pain or irritating pain, we're causing more inflammation and more flare-up of that condition, and the longer it's going to last. If we can calm down the pain early in the day and throughout the day, we're going to have fewer spikes in pain, fewer irritations, which means we're going to recover from that faster. And so work these in the morning, kind of earlier in your day, and then work these a little bit throughout the day to keep that tissue warm, keep it supple so it stays elastic, and we get less jarring irritation and pull across that elbow that causes more of that deep toothache type pain that is so common experienced with our folks who have tennis elbow, with shaking hands or grabbing a jug of milk from the fridge, and this never seems to go away. If you're still having elbow pain or struggling with any of these, let me know in the comments below and I'll give you a more personalized response.